We're here today and it's historic. This is the first briefing on Capitol Hill about LGBT aging. And all I can say is that in many unfortunate ways, it couldn't be more timely.
Despite advances in LGBT civil rights, many senior service providers do not consider their older clients may be lesbian, bisexual, gay, or transgender. And those who do often do not know how to provide services in effective and culturally competent ways. And this means that LGBT older Americans still face particular difficulties in the mainstream aging world, ranging from outright discrimination, as you've heard clearly from our other panelists, to formidable barriers that prevent access to services.
In part due to transgender older adults in particular, generally often come out and transitioned later in life. We found that 55%, so most, of the trans older adults had reported that they'd had a marriage and or a relationship with a partner and because they're trans. And 58% reported that they had lost close friends because of being trans. So the social isolation, the higher likelihood of living alone all particularly affect transgender older adults.
To make the Older Americans Act services more friendly and relevant to LGBT older Americans, we at SAGE suggest the following. Expand the definition throughout the Act to include lesbian, gay, bisexual, and transgender older Americans. Amend provisions where appropriate to ensure that states planning on aging address elders with the greatest social need, with particular attention to low-income minority individuals and older individuals residing in rural areas, a requirement to also address the needs of lesbian, gay, bisexual, and transgender older Americans.
So there's a real need to include sexual orientation and gender identity questions, along with other demographic information on federal surveys. This will give us a much better and accurate understanding of LGBT individuals' health concerns and will enable us to develop public policies and programs that will improve their health and well-being.
Social Security is an insurance company, and it's there for everyone, and the idea is that everyone pays in and everybody benefits. And it is the most successful anti-poverty program in the country, and is meant to lift up older people out of poverty, keep them from having to deal with poverty. There is this basic inequity and discrimination around same-sex couples who lose a partner and are not able to get spousal benefits, survivor benefits, and the death benefit upon the loss of their partner or spouse. We are working very hard to try and come up with a way that we can work to change that inequity, to provide equality amongst all couples,